Very pleased to say we're joined now by the Chief Executive of the UK Health Security Agency, Dr. Jenny Harries. Dr. Harries, it's been a busy couple of days for you, I'm sure, so I'm very glad that you've been able to make the time to speak to us. And of course, so much to discuss following the UK HSA's report from yesterday. I do want to take you back to a comment that you made about the Omicron variant when you said that it was the most serious threat that the UK had faced during the pandemic. On the basis of what the UK HSA reported yesterday, can you now moderate that judgment on Omicron?
So I think we can start to moderate that comment, but we don't yet have all the information that we need. When I made that comment, it was because we had very high degrees of uncertainty. We had a new variant which was showing clear signs in its structure and its expected behaviour that it would evade some of our immune defences. And that's exactly what we've found. We've seen in both the laboratory studies on antibody titers, on the antibody studies, and in fact in some of our vaccine effectiveness studies for symptomatic infection, that there is a reduced effect in comparison to the effects of our vaccines against Delta. What that report yesterday showed, however, is that where we're starting to look now at some of the signals against how effective our vaccines are and potentially previous infections are against Omicron compared with Delta, we can see that less people are coming into hospital, and it appears that there is a reduced signal of risk of hospitalisation. So that's a good sign, but as you will have heard just then, Dr. Hopkins saying, Chief Medical Advisor, that these are very early days, it's very small numbers, and most of the cases of Omicron in this country so far to date have been in younger people. We're only just now starting to see them tip into the over 60s and just this week into the over 70s group, and that's where we start being very worried.
Yeah, and of course, heading into Christmas, when so many people will be associating with the generations of their family, that we may well have a data set on that in the not too distant future. But in addition to that, I mean, I don't want to get all Donald Rumsfeld here and start talking about unknown unknowns. But what do we not yet know about Omicron before we can say, actually, do you know what? This, whilst a threat during the pandemic, is not the most serious one.
So the point I've made just now about the age group, we really need to understand that's really critical, because we know the majority of individuals who've sadly had to come into hospitals or who have died have been in those older age groups. We need to understand how that impacts with underlying conditions. As you get older, you tend to have more other illnesses alongside to contend with. But I think some of the other features we really need to understand as well, because the problem with Omicron is we've got lots and lots of cases. So even if the severity is potentially reduced, we still need to deal with these 119,000. That was a record number of cases that were recorded yesterday. So the sorts of things we need to see is, if somebody does come into hospital, do they, for example, stay the same length of time as somebody who had Delta? Do they need the same levels of oxygen? Do they need to go to intensive care as frequently? And all of those will signal what the pressures are likely to be on our health services.
Yeah, of course, in terms of the doubling rate, around about between 2 and 3 days at the moment. A couple of weeks ago, when we first started really getting concerned about Omicron, there was a suggestion that within a fortnight we could see, new cases on a daily basis up to 200,000. It's clearly not got to that state yet, in terms at least of those that have been tested. A slowing, perhaps, of the growth in the growth rate. Why do we think that might be? Is it because of the behavioural changes that many people have made, given statements from yourself and the Prime Minister, or is it just perhaps different rates of spread between different groups?
So I think there's a number of different points there. Number one, I'm not sure I would agree that the growth rate, that we have strong evidence it has come down. It's around two days for doubling time for most regions across the country, and it is very high in London still. So I think we shouldn't accept that. As you've noted that people do have different behaviours around their testing over festive periods. And so for the next few days, we think the data will likely not give a particularly true picture. It's likely to come back in on track as we go past the festive season. So I think that those are the key points in relation to that.
Of course, we are expecting, perhaps, to hear something in terms of additional restrictions, perhaps as early as next week from the government. One item from the SAGE minutes, which have just been released, which leapt to my attention, is this, and I'm giving this to you sight unseen, so apologies, Dr. Harries. The minute says this: data will be unreliable over the festive period. As testing and hospital admission patterns change, this will make it difficult to interpret any apparent trends over the next few days. Do you believe that the Prime Minister, the Chief Medical Advisor, Chief Scientific Officer will have the evidence to be able to make a decision early next week on further restrictions?
There's probably three pieces of evidence, and they are being looked at on a daily basis, and we will obviously be continuing to provide that information over Christmas. So I think that is a certainty. We keep looking at the data all of the time. Number one is it's actually the ONS survey, the Community Infection Survey, which is run routinely, which systematically samples people across the country, and we thank all of them for their help, that gives us the background infection numbers. Now, not all of those people who have infections in the community, sometimes because they don't know, they're asymptomatic, they won't always come forward. So there is always a difference, and it goes back to your 200,000 number. If we actually look at what ONS is saying at the moment, there's somewhere around in the previous week, they estimate 1.2 to 1.5 million people had coronavirus during that week. Now, those are not the numbers that come through our testing, so we always know there is a difference there. But I think the third point is actually looking at what we're really concerned about. We're concerned about people's health, we're concerned about transmission, but most of all, we're concerned to make sure that our health services can keep functioning. And of course, the health service data continues to come back in on a daily basis. And again, that is looked at regularly. So I think the short answer is yes, we have the data.
Good. Just in terms, though, Dr. Harris, something you mentioned a moment ago, something you alluded to a couple of moments ago, there doesn't seem to be within within our hospitals at the moment the pressures on intensive care and on ventilators that you might have expected. Is that just a concomitant of that which we were discussing before, that the majority of people going in are slightly younger at the moment?
So that's one of the uncertainties. You're absolutely right. It's relatively early days. There's always a lag between the rise in community cases. And of course, this has happened so quickly that we're still literally only 4 weeks since we came across this new variant. But we do anticipate more cases will come in as cases appear in the older age groups. But we are seeing signals across other countries, and we monitor that routinely, that suggests that perhaps the length of stay in hospital is a little bit less. People are not needing oxygen quite so much, and perhaps not going through to intensive care. The only caveat I would put on that is, of course, we had relatively high case rates before we found Omicron, and our hospitals are trying to deal valiantly, as they always do, with routine winter pressures. So I think there is what pressure is the NHS under, and then what contribution is Omicron making, and it's both of those together that we need to take into account.
Dr. Harris, of course, you're a lot closer to those making the political decisions in all of this. I barely get a card from an MP these days. So you may well disagree with what I'm about to suggest, but it certainly feels like, from the government's perspective, hospitalisations remains the key data point in terms of further restrictions. But given what we are seeing, particularly in the health service in London, significant numbers of staff themselves are off with Omicron. It feels like staffing might well become a tipping point for further restrictions.
So staffing for the health service, for the care service, I'd like to just, flag
of course, yes.
That's a balance as well for all our carers out there. And actually, for many of our other critical infrastructure services, you will want to ensure you have some food on your table for your Christmas meal tomorrow and subsequently. And of course, what we have done is looked at the evidence around the isolation period and what is safe. And we now have lateral flow tests, new rapid antigen tests available this year that we didn't have last year. And so we've been able to safely reduce the isolation period down, as long as people are taking and have 2 negative lateral flow devices 24 hours apart. So that actually starts to address some of the workforce issues. And for health and care workforce, who are clearly dealing with the most vulnerable, they actually take additional tests to make sure that is safe for them to return to work at that point. So it is an important point for all our critical services, all our frontline services, but we have ways for that, through that example of managing that, and obviously contacts as well. We now have lateral flow tests to ensure that people are very unlikely to return to work, even if they're a contact, and making sure that they're not infectious when they go back.
Indeed, and good point, well taken about those working in the care sector, Dr. Harries. I wonder if we might kind of conclude our talk, and thank you for spending as much time as you have with us. We've obviously had a lot to get through. Talking about the prospect of an additional booster. Already there seems to be a view emerging that a fourth shot, rather earlier than many people might have expected, might be necessary. And of course, we know that there will be work ongoing about an Omicron-specific vaccine at the moment. But in your view, is it just a question of when we get a fourth jab rather than if?
So obviously JCVI, Joint Committee on Vaccination and Immunisation, will be looking at this data continuously. And in fact, they do that routinely for any vaccinations. It's quite normal for our response to a vaccine to wane, and then we have a booster. We see it with childhood boosters, for example. Obviously, this is a new variant and it will take time for us to understand that pattern. But I think the critical point here is that even where we have seen some apparent waning against a symptomatic infection, we have not seen that subsequent waning in the same time frame against serious infections, serious disease, and hospitalizations and deaths. So I think this is far too early at the moment to call whether we need to have yet another booster. Obviously, as I say, JCVI will keep a look on that, and we will look at the vaccine effectiveness and our hospital data on a daily basis as we go forward, and publish in due course.
Dr. Harris, I do hope you've not got any presents to wrap, because I'm going to hold on to you for another couple of minutes, as we've just had a little bit of interesting data coming from the ONS, and we were talking about this just a second ago. And they estimate 1.7 million people in the UK had COVID-19 in the week up to December the 19th, the highest number since comparable figures began back in autumn 2020. I suppose, is that within the ballpark of what you would have expected, given the transmissibility of Omicron?
So I think what we're seeing is very, very high growth rates. And you're absolutely right. I think the data translates through something like 1 in 35 people across England have COVID. And in London, it's something like a staggering 1 in 15. This is very, we haven't seen rates like this before, but it is predominantly still an infection of younger people. So the 20 to 29 year group particularly, we've still got some Delta cases in very young children, and we have Delta cases in those people mostly who are currently in hospital. So this is a very, very mixed picture. And as we've just been discussing, some of the critical things in managing this is to be absolutely sure what the severity risk is, and our data at the moment is still quite early. I mean, I think it gives me an opportunity just to reinforce on those figures exactly that when people are enjoying their Christmases, and we really want them to, that we don't let Omicron enjoy it as well, that they should be being careful about what they're doing, obviously doing face, hands, space, ventilate the rooms that they're in, and particularly if you're going to visit somebody who is vulnerable in any way or has immunosuppression, to do a lateral flow test before you go, so that you know you can see them safely and they can feel comfortable.